According to the National Institute of Mental Health website, at least 1 in 5 adults in the United States is suffering from a mental illness. Further, the National Alliance on Mental Illness website states that 75% of mental health conditions begin by age 24 and that, and I quote, suicide is the second leading cause of death for youth ages 10 to 34. I am here to address the issue of the rise of mental health conditions in college students. We are all college students, which means that we all understand the mental struggles that higher education comes with. Many of us were told that college would be difficult, but few of us were prepared for college's mental toll on students. I am a 19-year-old entering my third year of college. Every fall and spring semester, I have attempted and completed 15 credit hours, and during the summer, I attempt and complete 6 credit hours. The workload that comes with being a full-time student is often stressful, painful, and feels never-ending. I rarely have time for myself, hardly eat, and have already been suffering from anxiety, depression, and attention deficit hyperactivity disorder since at least middle school. I feel that oftentimes college students' mental health concerns are ignored or invalidated by both those who have never attended college and those who have already completed college. I want to describe the surge of mental health struggles in college students, present logical solutions to this issue, and explain how to implement those solutions. First, I want to discuss the statistics, causes, and effects of the rise of mental health conditions in college students. Mental health conditions among college students are on the rise and prevalent. According to Mary Flannery, the senior writer for the NEA Today website, upward of 60% of college students experience symptoms for the diagnosis of at least one mental health condition. This is a 50% increase from 2013. In a survey of more than 90,000 students across the United States, nearly half of the students indicated that they were experiencing symptoms of depression, more than 1/3 suffered from anxiety, and almost 1/6 considered suicide, which was, and I quote, the highest rate in the 15-year history of the survey. Additionally, according to a report by the Lumina Foundation and Gallup, 64% of enrolled college students considered dropping out of their degree programs due to, and I quote, emotional stress and mental health concerns. The causes of mental health conditions in college students are broad. In a May 23, 2024 article in the Training Journal, Dr. Ravinder Tulsiani suggests that in general, mental health issues are on the rise due to stress from the COVID-19 pandemic, pressures from society, stress from working, unsureness about the economy, and the constant dependence on technology. For students, Tamak Ishaq and his peers at the Stevens Institute of Technology write in the 2020 issue of the Proceedings of the International Symposium on Human Factors and Ergonomics in Healthcare that trying to meet deadlines and lacking time management are main sources of stress. Further, Pranch Khemka and his associates write in the 2020 issue of the India Journal of Health and Well-Being that college students tend to suffer from sleep deprivation, which may lead to mood swings and depression. Mental health conditions have negative effects on college students. The National Alliance on Mental Illness website states that, and I quote, untreated or inadequately treated mental illness can lead to high rates of school dropout, unemployment, substance use, arrest, incarceration, and early death. Specifically, Tamak Ishaq and his peers at the Stevens Institute of Technology write in the 2020 issue of the Proceedings of the International Symposium on Human Factors and Ergonomics in Healthcare that depression is correlated to college students more often having a declined GPA, becoming ill, smoking, drinking alcohol, being anxious, self-harming, and dropping out of college. Also, the report by the Lumina Foundation and Gallup found that roughly half of adults aged 18 to 59 years old are not enrolled in higher education primarily due to, and I quote, mental health or emotional stress. To combat the development and negative effects of mental health conditions, college students need to be given healthy outlets to cope with their mental health struggles. College students need to become involved in organizations that bring awareness to mental health. Dr. Lisa Sontag Padilla and her colleagues write in the July 2018 issue of the Journal of the American Academy of Child and Adolescent Psychiatry that student peer organizations can bring attention to, and I quote, the unmet mental health needs of college students by changing campus attitudes about mental health and helping students access the appropriate mental health services. Mental health services and efforts need to become more available to college students to help them cope with their mental health struggles. Tamaka Shak and his peers at the Stevens Institute of Technology write in the 2020 issue of the Proceedings of the International Symposium on Human Factors and Ergonomics in Healthcare that many students would find it helpful for their mental health if they could access an application that would encompass, and I quote, mood tracking, exercise examples, and an interactive calendar that can be connected to courses to streamline access to homework, exams, and other deadlines. In addition, students express that campus counseling services should be accessible online for the sake of comfort and convenience, which would allow more students to receive help. For these solutions to work, they must be implemented effectively. First, to encourage students to join organizations that are centered around mental health awareness. These organizations must make their presence known by advertising their benefits to students through social media, physical media such as posters, word of mouth, and mass communication such as a university-wide email. Next, universities could be encouraged to partner with app developers to create an all-inclusive app that would provide students with access to mood tracking, journaling, exercise guides, and time management features. An app of this nature would improve students' mental health while increasing or benefiting the university's reputation. Also, universities must foster a positive atmosphere or healthy environment for students, so they should set aside funding to create posters that spread positivity throughout campus. Then, to further meet the needs of students, universities should provide access to online counseling and advertise this service through its website and classroom resources. While many large universities have already implemented some of the solutions mentioned, there are plenty of universities that have yet to take action, and there are still more ways that universities can provide mental health support to their students. I have described how and why college students are experiencing a rise in mental health conditions, presented student-suggested ways to help college students' mental health issues, and explained how organizations and universities could apply the proposed solutions. I encourage you to join organizations on your campus that focus on mental health. Contact your campus counseling services to suggest new ideas aimed at supporting more students, and spread positivity on campus. We college students are not alone in this struggle of mental health issues. It is important to be kind to yourself, be kind to others, and seek professional help whenever you need it. One failure is not worth your entire life. Whatever happens in life, there is always something else to look forward to. Just remember to live, learn, and grow. You will get through this. Thank you.